Okay. Alrighty. One. Okay, good evening, good evening, good evening. Welcome again to Boss Lady Live. We are 2 minutes early. We want to ensure that everyone comes on, jumps on, so we can get to start the ball rolling. This evening, we are speaking to Dr. Heather Dawn Lawson-Myers, oral health. I like to call her oral health specialist, dentist, right? And this evening, we're going to be talking about oral health. Now, we know that it's not a sexy topic, but indeed it is a sexy topic because oral health is very important to our relations, our sexual relationships, because we want to be fresh to death in terms of oral hygiene when it comes to our personal health and wellness. So this evening we will be talking about oral health, and let me tell you, I had no idea that oral health included so much until I sat down with Dr. Myers, because she is a wealth of knowledge. And for those who don't know, she has a lot of blogs on oral health, but she will tell you a little bit more about that further on down in our program. So people are popping on. Lovely, lovely, lovely. We're 8 on, so we can pretty much start. Yes, hi, Christine. Hi, Phil. Good evening, good evening, good evening. Thank you very much for being so punctual. I have my punctual friends tonight. So what I'm gonna do, because my viewers are having a problem finding us on YouTube. So what we're doing now is we're gonna start on Facebook, and then we're going to jump on over to YouTube eventually, somewhere in the program, because we're trying to get you accustomed to being on YouTube only. We are at www.youtube.com/ the totally male. No, sorry. Yes, the totally male. That's www.youtube.com/the totally male. So welcome to everyone, one and all. Good evening, Andrea. Glad to see you this evening. All right, so this evening, let me first introduce my guest before I start. She's Heather Dawn Lawson-Myers, DDD, FAACP. She'll tell us what that means in short. Dr. Heather Dawn Lawson-Myers received her DDS from Howard University College of Dentistry in Washington, D.C. in 1988. Together with her dental team, Dr. Lawson-Myers serves a broad cross-section of patients in the Kingston and St. Andrew metropolitan areas at Ligonier Family Dental. That is in Seymour Park, right? It's in Seymour Park. Shop number
3.
Shop number 3. Right? Very, very centrally located. She is a fellow of the American Academy of
Craniofacial
pain, that's and in brackets AACP, and a member of the American Academy of Dental Sleep Medicine, AADSM, which I'm very excited to tell you about because I'm going through my little sleep apnea situation. So, and she gave me a excellent overview of what I'll be going through and all of that, and what my needs would have been and all of that. So I want to get into that because, you know, there's so much to oral health that we don't even know. So Dr. Lawson-Myers is an active member of the Jamaican Dental Association. She also holds the distinction of being the first female chairman of the Dental Council of Jamaica. Now, you know, I don't carry no dibby people. I carry only the best, the cream of the crop, the top of their profession, as you have seen for my two series. So you know I carry the best, right? And she also, she previous positions held on the Dental Council include chairperson of the Dental Board Examination Committee and chief dental examiner. Dr. Lawson-Myers she also found the time to have children. She's a mother of a son, Jarrell, and daughter, Shauna. She is actively involved with liturgical dance ministry at Swallowfield and is founder of Abigail TFM, a foundation which equips and trains women who mentor girls and young ladies. She also enjoys participating in modern dance classes, walking in the early morning, and entertaining her friends and family during her leisure time. Now, I don't understand. I'm looking upside down the phone, but I'm not seeing an avid music person
That's
because we
true.
meet up at almost every music festival because you and I have a passion for music. So I don't understand how that is not in your bio. You left
True
it out.
that. True that.
Yeah, because we are so passionate about music. So Heather, welcome. Welcome to Boss Lady Live. Friends, please like and share. Please also subscribe to our page and to get all the information that I have given. Heather, welcome.
Thank you so much, Sandra. It's my pleasure to be here.
Okay, so apart from what I have said, just give us a little overview of, why did you choose dentistry and what has the whole experience of being in dentistry been thus far?
Well, I think dentistry is the best profession that I could have ever chosen. I have to say, it's divine intervention where I got into dentistry because when my mom first introduced the thought, I was like, no way. But then sometime later, a friend of mine was passing and he had some brochures and I inquired as to what it was, and it happened to be brochures about the dental school. We were both at Howard University at the time. And I ended up going to dental school and I absolutely love dentistry. I
Wow.
love it because there's the scientific side of me that it appeals to.
Mm-hmm.
There's an artistic side of me that it appeals to. There's a training and teaching side of me that it appeals to. And there's the relationship side of me that it appeals to. So it's really just been a win-win for me. It's been a wonderful journey.
Many of us when I say us, I sincerely mean us. I remember I was paranoid, petrified when it came to going to the dentist when I was growing up. My mother, I believe one time she had to buy me a bicycle to con me into going to the dentist because I was having issues with my teeth. And I just for love or money, I would want to go to the dentist because I just remember the tools. I just remember being traumatized by the drilling and all of that. And I must say, when I went to your establishment for the first time, because I remember asking you, I tell you, I'm very afraid of injection and these things. I remember the first time I came to you and I got a hand massage and a warm pad
Neck
on
wrap.
my shoulders and a hand massage. It was so fabulous and that totally relaxed me. I don't recall even getting my teeth cleaned because it was such a, a very great experience, and people don't understand customer service even when it comes to dentistry. Yes, they understand the benefits of getting your teeth filled and your teeth looking beautiful, but people are traumatized, especially the males. I know for certain that a lot of them speak about, boy, the dentist, they don't like pain. Men don't really like pain. They're very their pain threshold is very low. So, the whole customer service side of it. Why did you think it was important to add that element, that real comforting, that you have a family feel when it comes? And it does say family dentist. I know family means you deal with the whole family, but it also has a family feel, as if when you go there, you feel like you're going home. How did get why did you go that route?
Well, first of all, we treat people who happen to have teeth. So we don't treat teeth.
Right.
We treat people who happen to have teeth, and we know a little
Absolutely.
something about helping them to take care of the teeth. So we look at the whole person as opposed to just drilling down into what's happening in the oral cavity. And everybody has something that makes them feel a little anxious,
Yes.
especially if you've had a negative past experience. I must say that dentistry has come a long way. The dentistry practice today is very different than the dentistry practice when we were children, just because of modern technology and improvements in the field. And so people are responding to their last experience. If it was
Absolutely.
positive, it was good. If it was very negative, it was bad. So our goal is to get you comfortable, find out what your needs are, and be there to cater to your needs as far as it relates to your oral health, which then affects your overall health.
Right. Okay, so I want us to do it chronologically. So when should one start going to the dentist? Well, we have to speak to the parents at this point. So when should you start taking your children to the dentist? Because I know there's a process. I know we change our teeth at a particular age. So when should the whole dental process start? I mean, this is outside of if you're born with issues like you had like cleft lip or whatever. But when should you really start taking your kids to the dentist?
Okay, so let me just back up a little bit to
Hmm.
pregnancy.
Right.
It's very important when the woman knows that she's pregnant or planning to be pregnant to make sure that her oral health is good, because if she has conditions, say periodontal disease, which is a fancy name for the inflammation of the supporting tissue, that would be your gums and your teeth. It's not painful, so she may not be aware that she has this condition,
Hmm.
but it can significantly affect her pregnancy. She can have preeclampsia, which can elevate
Really?
her blood pressure. And so, because, you know, there are things that look very similar in the body, and sometimes the body thinks one thing is another thing. And so, it's possible that when you have periodontal disease, the body can see some things that seem to be the same thing that would stimulate um, labor. And so you can have early labor, low birth weight babies. And so we encourage pregnant women, first and foremost, as they're looking in preparation for or early stages of their pregnancy, to go ahead and get their teeth checked. Once the baby is born, we allow moms the first year. After the first year, it's a good time to have a check in. This doesn't mean that we're necessarily going to do any dentistry, but we want to make sure that the growth and development is within the normal order. And usually at around 3, we see the child for the first checkup. Now, in our office, we have an office visit. So we'll bring the child in just to get them acclimated, to see how the chair works and the water and the this and the that and the light. And so by the 6-month visit from that, they come in, they're very familiar with it. So we're able to clean and examine it. So now there are some children, they'll sit down the first visit and open up and you could do everything. But
Right.
most kids want to test the waters, and so we do that. We also like to work with the growth and development of the children. So by age 6, Jamaican children are a little, what we would call previous, early. So
Yes.
some start from as early as 4.5, 5, but usually at around 6, you begin to lose your lower front teeth. And at that same time, you begin to get your first set of permanent teeth that develop behind the baby teeth. So the face grows this way, it grows this way, and it grows this way, right? So there are teeth that will come in behind the baby teeth that are not replacements. As those teeth come in, we want to get to those teeth as soon as possible to put protective sealants on them so that they don't get tooth decay. A sealant is
Oh,
just something that we flow into the grooves of the biting surfaces of permanent teeth. Sealants coupled with brushing and flossing and routine visits can totally eliminate tooth decay. So we have kids that we've seen from they were toddlers, now they're in their 30s, they've never had a cavity. And it's not rocket science, it's just some basic knowledge that we
Wow.
were able to share with them and go along the journey with them to keep healthy and maintain good oral health. Usually, by the time the kids are going into high school, um, that's around 11, 12, maybe 10 for some. They're getting their second year molars, which come in behind the first set that come in at 6. So you have a set that come in at 6, you have a set that come in at 12, and then we get wisdom. The wisdom teeth come in between 17 and 24. So between, I would say, 5, 6, and about 13, kids are changing teeth all the time. Now, there's a myth that, if there's disease in a baby tooth, it's going to fall out. So no big deal. Just let it remain. The
Right.
problem is any source of disease can do damage to the body. Now, if you have a baby tooth that is not cared for and it gets badly decayed, that disease in that tooth can significantly negatively affect the permanent tooth that is developing under that baby tooth. Okay?
Wow.
The other thing is this area here is an extremely sensitive area. The base of your brain is just below here. So in a child's mouth, everything is condensed in the child's face. So it's possible that an uncontrolled infection can lead to death. Doesn't happen all the time, but it can. An infected baby tooth at the bottom can create so much infection that it can close off the throat. So we don't want to ignore any form of disease at
Right.
all. Mhm.
Wow.
So we should address teeth whether they're baby teeth or not.
When I also go to the dentist, I realize also that you always check in the different areas, the base of the neck and all of that. I know I have a history of cancer, but is that a general thing that dentists are always looking for other different type of what are some of the things that we can develop in the mouth area?
Well,
Mouth and throat.
we recommend that you visit the dentist every 6 months. And when you come into our office, we routinely do an oral cancer screening, which allows us to check the neck for any enlarged glands, anything that feels different. We check inside the soft tissue in your mouth to see if anything looks and feels different. So every 6 months, we're going to do a check that includes an oral cancer screening. Now, only 3% of the population will get oral cancer. But of that 3%, the mortality rate can be as high as 98%. So the
Is that
earlier
because
we...
people don't check for it?
Correct. In the early stages, you don't feel any pain. So if you're not continuously examining your mouth, something may be going awry and you have no idea. I'm going to use my loops and my light, and I'm going to be looking in places that I know sinister things can happen to ensure that I can alert you to anything that may be going awry. And traditionally, we have linked oral cancer specifically to alcohol intake and smoking. But in recent times, there is another type of oral cancer that's really not in the forefront of the mouth, it's really in the back of the throat. And that is directly related to oral sex. So it's possible that younger people now, because of sexual habits, are getting oral cancer from different causes, different sources. So we check everything, and
that's
we don't
from
make...
the HPV virus, right?
Correct. You did your homework.
No, actually, you see, because I've been having a series of programs, and we were talking about vaginal health, and the doctor spoke to us about persons able to get oral cancer from the HPV virus, and so that is you should get an injection from as early as I think she said 11 or thereabout,
That's the
because
recommended
once you
age.
become sexually active, it,
Correct.
it lessens your possibility of the effectiveness, I believe she said, of the injection.
Correct.
Okay, so
Correct.
I know there is well, there's the ENT specialist. So we all know that there is a connection between the nose, the ears, and the mouth. Now, my mom died of tongue cancer. Now, my mom was never a smoker. She never drank. She never partied, really. I mean, from as much as I knew her. But so we don't know persons, or there was a individual that was saying to me maybe it was acid reflux that may have caused it. I don't know. I mean, we don't. There are various different things that people get that there is no rhyme or reason. And her first sign of pain or that something was wrong was in her ear. She had an ear infection. Well, she thought she had an ear infection. When we took her to the doctor, they were treating her for an ear infection until we eventually went to the third doctor, and he pulled out her tongue and saw that there was a surface tumor. So let us talk about some of those things also that we need to be checking for, because we don't check for these things. We do pap smear and we do all of these things, but we're not aware of that these things can mean something. Heaviness in the ear, because as I was telling you, I was having heaviness in the ear, and you're saying, did you ever get a sleep test done? And I was like, huh? Because that is not something that I have ever been told that may, if you're having a heaviness in the ear, or you're having an ear pain, or, that can be connected to something else. This is not something that we really seek the information for. So if you can just talk a little bit about that as well.
Okay, so any kind of um, anytime an area is getting more than it needs in terms of acid, you're going to have some deterioration of the tissue, right? And so the question is, why are you having acid reflux? Is it truly acid reflux, or is it something else? Uh, what I'm going to suggest is that if someone has airway issues, and I'm defining the airway as that tube behind your nose that travels behind your mouth into your lungs. If you have airway issues, you could have a situation where you have the gases from the acid gases from your stomach constantly coming up into your mouth and to your nose. And if you have that, you're going to have some degree of irritation.
Mm-hmm.
Now, the reason why I spoke to you specifically about your concerns is that when I looked in your mouth, I could see that there was a pattern of acid erosion on your teeth that was specific to acid coming from your stomach as opposed to you drinking a Coke or a Pepsi.
Right.
Right? There were other things that I saw that were red flags to me that made me ask you further questions, which included determining if you felt that you were having heartburn or anything. Some
Right.
people recognize it, some people don't. But asking a series of questions and looking at some oral manifestations allows me to join the dots sometimes. The reason why, if someone has an airway issue, they would have issues with acid is because there are different levels of sleep. And there's a level of sleep known as REM, or rapid eye movement sleep, when all the muscles go flaccid. They're just paralyzed, except for your diaphragm that's moving and your heart that's pumping. So if that tube during that time, which has no skeletal or bony support, collapses upon itself, then it prevents you from getting air into your body. So, if that is so, Your brain has one function: to keep you alive. You can live without food, you can live without drink, but you cannot live without oxygen. So if that collapses and the body perceives that you're not getting enough oxygen, there's a danger signal and you're
Right.
going to go, whether you're awake or not, you're going to, and every time you, sometimes it's so strenuous that everything comes up. And so you throughout that night, acid may be coming into your mouth constantly and sometimes into your nose and causes chronic sinus issues.
Yes. Which was I was having a symptom of chronic sinusitis. But everybody we treat in Jamaica, everybody, sinusitis is like you say have a common cold. So everybody says, oh, we have sinus, and we kind of dismiss it. But my thing was persistent. And I mean, when you said it to me, and one other doctor had said to me about, if because I was having a blood pressure issue. Now, folks, all these things are connected, and you don't even know that they
Absolutely.
are connected, because I am on medication for high blood pressure. But my blood pressure now has not been going down with the medication for a while now. It's just been going up and up and up and up, and it's not going down. And so when I went to Dr. Myers to look about my teeth, and she was connecting the dots, as she said, I eventually went to the doctor,
The
to get
pulmonologist and had a sleep study.
pulmonologist, and
Yeah.
had a sleep study done, which really turned out that I needed the sleep apnea machine, which is a CPAP machine, it's called, which I now have, which last night for the first time I used, and I slept like a baby. Took me a while to get the rhythm of the machine, but I did not snore. Hallelujah. I did not wake up with dry mouth, and I could I was breathing freely. So, and that was just going to the dentist. That was going to the dentist, people, right?
Well,
So I'm saying it's not all. I mean, and you were able to see all the different signs in my teeth, but I would not be looking for that, So these are some of the things that, we don't even know that oral health includes.
right. So the thing is, sometimes if you don't know the source of a problem, you can be treating the hypertension separate from the ringing in
Absolutely.
the ear, separate from the sinusitis. But if you realize the source of all of those things and you treat the source, then all of those things are controlled. Anybody who is going through several medications and the blood pressure can't be controlled, I'm
With
not saying it's
exercise,
absolutely, but I'm
diet, and
saying,
all of that.
yeah, I'm saying that is one of the signs that
Yes.
leads us to believe that you may be having airway issues. Yeah.
Yep. So thank you for that. Okay, so Doc, Mr. Henry said, I had a baby tooth that was never out until 30 years old. Is this uncommon?
We don't know why, but males more than females often have, we call them over retained deciduous or baby teeth. Now, sometimes the permanent teeth are up there and they just haven't pushed down. Sometimes they're in the wrong place. Or sometimes the permanent tooth buds don't develop. So, what happens when you're changing teeth is the baby tooth is literally pushed out as the permanent tooth comes down into the mouth or up into the mouth. But if you don't have something to push that baby tooth out, it stays. Now,
Oh,
sometimes instead of pushing directly under the baby tooth and pushing it out, it comes in a little behind or a little before it, and you get a double row because now you have the permanent tooth coming in and the baby tooth didn't come out. But sometimes that baby tooth just sits there because there's absolutely nothing to push it out. So normally we'll take a radiograph, which is an image that allows us to see what's going on in the bone, and we can tell whether there's a permanent tooth there that just didn't come down or whether there's just no replacement for that baby tooth. And so it's there.
okay. It says, how far back on the tongue should we brush? Gagging is an issue.
Okay, so that's a very individual thing, right? There's some people they can get that toothbrush way back there, and there are others just the top, the front of the tongue, and they know they can't go much further. There is a theory that says if the back of your throat is crowded, then you just naturally protect that area. And so you have a strong gag reflex. So that person wouldn't be able to get very far. Others, they could almost put that toothbrush down their throat and they don't gag. So it's a very individual thing. What I would say though is as far back as you can get that toothbrush to brush your tongue is what you should work with, because if you feel that you're going to vomit each time, then it's going to be a deterrent and you're not going to do that. And the reason why you brush your tongue is because the tongue has hair-like projections and bacteria can get stuck in there. So if you're brushing your teeth all the time regularly and bad breath is a problem, perhaps bacteria is staying in the hair-like projections of your tongue and causing a smell.
There are various different schools on brushing. What is your advice on brushing? I know brush tongue, cheek, under the tongue, up and down, crossways, back and forth. What is your school on brushing?
Okay, so there's a specific technique that I recommend, but first and foremost, I do not like medium or hard bristled toothbrushes. I only like a soft bristled brush because if we're going to touch all the areas, we don't want to traumatize the soft tissue, and we want the bristles to be flexible enough to slide below the gum line and slide around the sides of a tooth because no tooth is flat. Each tooth is rounded. And if you have bristles that are not flexible enough to slide around those curves, then some areas of your teeth get brushed and others don't get touched at all. I think it's good to run that soft brush over the roof of your mouth, around the cheeks, anywhere that you can get that brush, because really what you're doing is that mechanical action is removing any bacteria that is anywhere in your mouth.
Okay.
And that's the specific technique requires you to just angle your toothbrush so that the bristles slide up under the gum line and you can see a little blanching so you know that the bristles are under there.
Right.
Because we tend to think that the teeth stop where we see them ending, but they extend below the gum line, and there is a space just below the gum line where buildup can accumulate and remain undisturbed unless you go up under there and remove it and
Right.
cause tooth decay and gum disease.
You spoke a little about periodontal disease. Can you just expand on that?
Okay, so the periodontium is a fancy name for the gum and the bone underneath the gum that holds your teeth in place. That's your periodontium. You get buildup on your teeth every day, regardless of whether you eat or not. There's a soft, sticky substance, and you know it. You can feel it. You can literally scratch it off your teeth towards the end of the day. That's known as plaque. If plaque is not removed on a regular basis, after 2 to 3 days, it gets hard. And once it's hard, you can't brush it away, you can't floss it away, but it stays there and it causes your gums to become inflamed. Inflamed tissue is very vascular, has a lot of blood vessels, so it bleeds quite readily. So one of the earliest warning signs that your gums are not so healthy, bleeding. You may just see a tinge on your toothbrush or on your floss, but you know the same type of tissue that makes up your gum makes up your scalp. And if I was brushing my scalp and it bled, I would be alarmed. So in the same way, if you're brushing and you're seeing any bleeding of your gums, it's a red flag that the gums are not so healthy. Now that buildup, that soft buildup that's not removed, becomes hard after 3 days, and then it starts to migrate down the roots of the teeth. As it migrates, over time, it can eat away your bone support. Guess what holds your teeth in place? The bone. So if you lose your bone support, you lose your teeth early. So periodontal disease is the disease of the supporting tissue that hold and support your teeth in your mouth.
And this is only from not brushing your teeth? or
Well,
there's something other than that that causes periodontal disease? Is it unique to some people? Only some people get it, or any and everyone can get it?
if you brush away the plaque, if you floss in between and get below the gum line and remove the plaque efficiently, you cannot get periodontal disease. If you do not remove the plaque, if you do not floss and get it from between the teeth, if you do not use that soft bristle brush to go below the gum line and remove the plaque, you will get gum disease. 90 something percent of the adult population has some form of gum disease. And that too carries an odor. Bacteria lets you know that it's there. It has a smell. So a lot of times when you say, "Oh, that breath smells so bad," it's telling you something. There's bacteria there that should not be there.
Okay, another thing that we know causes bad breath also is unchecked sinusitis that drains to the back of the throat, and also when we don't when we have what do you call it again, ulcerated stomach, that also causes bad breath as well, right? Am I correct?
There are a couple of things that can be going wrong in your stomach, and it can manifest it. Well, you can have some awareness that something is not right by the fact that it gives your mouth an odor. If you don't eat on time, you have ketone acidosis, it smells. You know, if you don't eat on time, your
Right.
mouth gets
Yes.
pasty and it has a thing.
Right.
If your sinuses are infected, you're going to have an odor in your mouth. So there are a couple of reasons why you would have bad breath, including the type of food that you eat. You know, cheeses and then pungent spices like garlic and onions, and so will affect your breath as well.
What about your tonsils? You know, when people say they have tonsillitis and these little white oozy things coming out of the tonsils. What causes that? And what's the
Okay,
name
so
of
you're referring to tonsil stones. Now,
Yes,
your tonsils,
which
the
is a
primary
serious
purpose,
health.
yes, it's just one of those things um, that is designed to take waste out of your body. So, if you were to look at the tonsils closely, it would look like it has little indentations.
Right.
It's not a smooth surface. And what happens a lot of times is the bacteria accumulates and it forms these little white balls that can be housed in those little indentations in your tonsils.
Mhm.
And one day you're talking or coughing and laughing, and this thing just comes into your mouth and it tastes awful, it smells
Smells
awful,
like
but it's your
something
body,
died.
getting rid of waste.
Okay.
So again, bacteria has a smell. So you're getting rid of waste. It has a smell, and if you know what it is, then it's not a problem. If it happens occasionally, it's really not an issue. If it's something that's happening all the time, maybe we need to see why. And
Right.
then a visit to an ENT would be able to give us some window into what could be happening there.
But my experience is that it would appear, let me say it would appear, because one, I cannot believe that someone could have bad breath and not know. So is it that the person has this issue, and because they are up close and personal and have it for such a long time? Because I've known people that have bad breath that, I mean, their mouth is closed and you're still smelling their breath through their breathing, or they speak across the room and it's as if something died. So is it that they, because they're the one who has it, they are immune to it, or they're not smelling it because they have gotten accustomed to it?
So you can't smell your own breath. Even when you're doing this, you may have some idea, but you really cannot smell your own breath. As you're speaking, the air is going out, right? So whoever is on the other side is going to receive that. But most times, if you have bad breath, somebody lets you know. It's not because you can smell it, okay? But again, bacteria lets you know it is there because it has a smell. So somebody who you can smell coming
Mm-hmm.
they're not in good health.
Right.
They are not in good health. Any form of disease can have an odor. And sometimes it's beyond just hygiene, sometimes it's disease. And so further investigation may be needed. But let's say you've had periodontal disease for a number of years. Everybody around you knows that there's a problem. They may not know that it's periodontal disease, but you have an odor because
Right.
bacteria carries an odor, and you cannot have periodontal disease without bacteria.
Sometimes I think the root looks green, green or
Okay,
brown. What is that?
so
That's not paradox.
with periodontal disease comes bone loss. And if you lose bone, the gum is going to move up and follow the bone. So sometimes when you're looking at an exposed root, it's a
Yes.
different color than the tooth that you see, than the portion of the tooth that you see in your mouth. Now, that's one color difference. Another color difference is that same plaque that I was telling you about. If it's below the gum line and it's been there for a while, it looks like a dirty green.
Right.
So it's possible that that person can have what we call subgingival or below the gum line calculus or buildup or tartar. And that has a
Okay.
different color. Or if you have tooth decay can look white or it can look black. So if you have tooth decay around the gum, it can look dark. So there are different reasons for different colors
Okay.
below going up the gum on the tooth surface. Does
Okay.
brushing the gums affect your taste buds? Not that I am aware of.
Yes.
Because you're using a soft bristle brush to remove bacteria, you're not damaging the tissue at all.
Okay. It says if the hard brush has damaged the gum, is there a way to replenish or regrow receding gums?
So if you have receding gums, they're not going to naturally come back down. Sometimes we can refer our patients to the periodontist, who is the specialist who deals with soft tissue in your mouth, and he may be able to surgically create a downward pull on that gum. It's not always successful. It's not going to come down naturally. So using a soft bristle brush to prevent the recession is the best thing.
I had a situation where I wore braces for almost 3 years, and because my face was twisted, I had to wear a permanent plate in the roof of my mouth. So what happened? They had four silver brackets, and for those two areas that the four, because this was something that was fixed, and you can't get a brush under it, and the flatting was a problem. So after I removed that, I had to do go to the periodontist surgeon, and they had to cut the gum to tighten the gum, because now, because they took the brackets out, the gum was loose around those teeth, and so they had to cut, slice the pare down the gum, stitch it back, and tighten it. So now my I don't have food being caught,
Trapping, yes,
trapping.
yeah.
So I know that is something that can be done as if you have, if you are somebody who went through orthodontic work, and you have issues, because sometimes the brushing during that period is not the best. So Sherine says, is there any way to correct fluorosis in kids when all the new teeth are coming up with fluoride marks? So can you explain what fluorosis is
Yeah,
first?
sure, my
And
pleasure.
yes.
So fluorosis is when you have so much fluoride in your system that it begins to make your teeth look chalky.
Okay.
So I always advise parents, when you are putting that toothpaste on the toothbrush, don't follow them commercials. It's way too much toothpaste.
Mhm.
Just a little pea drop on that toothbrush is sufficient. And we don't want the children to swallow the toothpaste because fluoride as a topical application is good. But when you ingest or when you swallow too much fluoride, it has a negative effect on your teeth.
Oh, wow.
Now, in Jamaica, we don't have fluoride in the water like other places. So we generally ask parents um, to use a little salt when the children are of age because there's fluoride in Jamaican salt. And
Right.
fluoride is something that you need for the health of your teeth. It's just that if you ingest too much, it creates a problem. I don't know if it's still done now, but there was a time when pediatric physicians would give a fluoride supplement, polybiflor. And sometimes you ingested too much of that, it would create flourosis. Unfortunately, fluorosis is not reversible. But there are some cosmetic tricks that we can do if it's really um, if it really affects your aesthetics when you become older. So no, fluorosis is not reversible. It is Fluoride is absolutely good and essential for your teeth. In fact, before fluoride was introduced in Jamaica, many more children would have bombed out teeth, several teeth in the mouth. But with the fluoride in the salt, it has significantly reduced cavities. Now, with young children who going to swallow the toothpaste, we do not recommend toothpaste with fluoride because they're going to swallow it. Once they've gotten to the point where they can understand emptying out rather than swallowing, then we can switch to fluoride toothpaste and just a little bit on the brush. Okay? There's another question. When the
Yes.
tooth
When the tooth
begins to.
begins to yellow, is it the erosion of the enamel?
Okay, so here's what I'm going to say because we're speaking about children. There is a period of time when we have baby teeth and adult teeth in the mouth at the same time. Baby teeth are naturally whiter in color. We call them milk teeth. So sometimes when the permanent teeth are coming in, they look creamy in relation to the white baby teeth. They're supposed to look creamy. Secondly, tooth color varies like hair color. The outer layer of the tooth is enamel. If it is opaque and you cannot see through to the next layer, those teeth appear more whitish in color. If the enamel is more transparent and you can see through to the next layer, which is dentin, the teeth appear more creamy in color. Now, having said that, there are things that can stain your teeth. Going back to that same plaque again, if that plaque is not properly removed, it can form a thin layer over your teeth, and coffee can stain that thin layer, tea
Smoking.
can stain that thin layer, cigarettes can stain that thin layer. Any number of things can cause staining. That's why when you come and you have a dental cleaning, the stains are removed. That's an extrinsic stain. There's a possibility that you can have an intrinsic stain where the stain is inside the teeth. Tetracycline is a very good antibiotic, but we do not recommend it for children because it will cause intrinsic or internal staining of the teeth. So tooth color varies for a number of reasons, including natural reasons. What causes tooth decay? Okay, so we get buildup on our teeth every day, Cislin, and if you don't remove that plaque, it's going to cause cavities. All right, if you have sugars in your mouth that are not removed, that um, will help to cause tooth decay for sure. So let's say you have a child. You want to give the child a candy. What's the better choice? Give them something that they can suck And when they're finished suck, it's done. If it's something chewy, long after they're finished, bits of that chewiness is still in the teeth, causing damage. So I'm not saying that your kids should live in a bubble and never have candy, but think about it. If the kids love sweets, fruits as opposed to candy is a better option. Okay. If the child loves juice during the day, not at night, especially before they go to bed, because juices have a lot of sugars in them, and sugars will deteriorate the teeth, right? Plaque and sugar create an acidic environment, and that's when you have tooth decay. You know, when most of the challenges occur in your mouth when you're sleeping. So you want to brush at night, especially before you jump in your bed. Otherwise, the bacteria has free reign for the 6 to 8 hours that you sleep. Okay. So if you want to fight cavities, soft bristle brush, angling the toothbrush so that the bristles get below the gum line, disturbing the growth of bacteria in between the teeth every day with the floss, um, being mindful of the fruits that you eat, because if you have a lot of acidic fruits, you need to rinse out your mouth so that that acid doesn't stay there. Be mindful of the chewy sticky things that will stay in your teeth long after you've finished eating. um, and so if you are aware of what you're doing when you're doing, you can do anything in moderation, but the key thing is to make sure that you're proficient with removing that plaque at night before you go to bed and in the morning after you've had breakfast. You can brush as many times as you want to during the day, but you should brush in the morning after breakfast and at night before you go to sleep.
Is it recommended to use baking soda daily on your toothbrush along with your toothpaste?
Absolutely not. Baking soda is very good at getting rid of stains. And the reason it's very good at getting rid of stains is that it's abrasive. It's too abrasive to use every day. But if you use it once a week, I'm fine with that. It will help to remove the stain. But it's far too abrasive to use daily.
Okay. Country people uses something called chew stick that has a slightly bitter taste and produces a sod-like consistency. They use it to clean teeth. What do you think about
I,
it?
I'm very aware of Chew Stick, and I think Chew Stick did what it could do in its time, but it can't compare to the toothbrush and the toothpaste that we use in these days.
Mhm. There is a school of thought that some mouthwash removes its good bacteria. Is this so?
So here's what I'm going to say about mouthwash. If you are diligent with your brushing and flossing, you really do not need mouthwash. But if you are going to use a mouthwash, read your labels. I don't want you to use anything with alcohol because alcohol dries out your mouth. And one of the main benefits of the saliva, the fluid in your mouth, is that it's a cleaning agent. It helps to flush out the bacteria. So if you're using something that's going to dry out your mouth, you won't have that cleansing action.
I find when I use mouthwash, it burns me up. If I don't dilute it with water, I get sores in the roof of my mouth.
Some of them are very, very harsh. Very, very harsh.
Yeah.
So again, I'm saying that you really can have good oral hygiene without mouthwash. But
Mhm.
if you're going to use mouthwash, look for one without alcohol. And I'd have a problem with you diluting it, Sandra, because you know your body best,
Right.
right? Hmm.
And even some of the toothpaste as well.
Yes.
I find some of them are extremely harsh because sometimes them the double, triple. I mean, and sometimes you don't need that. Some similar to some of the products that we use on our face. If you don't have acne, it don't make sense to use acne products because the acne products are harsh. So it's a similar thing I find. If some of those toothpastes are very, very harsh and you don't need it, don't use it. Because if I find it really makes my mouth sore.
So most toothbrush most toothpaste companies have several formulas.
Right.
The routine formulas most people are fine with. However, tartar control is harsh. Whitening is
Hmm.
harsh. So the normal toothpaste for most people, fine. But then if you have sensitive teeth and gums, you might want to use the sensitive toothpaste in whatever line. Now, the only thing that I would caution you about sensitive toothpaste is a lot of people like to whiten their teeth, and sometimes when you're whitening your teeth, it makes them sensitive. So the persons that manufactured toothpaste for sensitive teeth said, well, why not marry these? We'll whiten and we'll provide a sensitive component at the same time.
Right.
I don't find that they work very well in controlling sensitivity. So I would just say look for a formula that does not whiten and just use the toothpaste for sensitive teeth. Now, if you have sensitive teeth and you're using toothpaste to get that under control, it has a cumulative effect. That means the first or second time you use it, you may not feel a difference. But after a while, you realize, teeth don't feel sensitive, and I had that cold drink. Teeth don't feel so sensitive, and I had my tea. So it's all about playing detective and figuring out what works best for you. What's the best way to maintain the health of an 18
Month
month
old.
year
Month,
old teeth?
18-month old.
Okay, yeah, so that's a year and a half.
Yes.
Okay, at a year and a half, you should have quite a few baby teeth, right? So you want to use a very, very soft bristled brush in an 18-month-year-old's mouth. In fact, you can run the bristles under the hot water to make sure that they're super soft. Just a tip of toothpaste, and it's not going to be the fluoride toothpaste. And you make sure you go around using your toothbrush and a little bit of toothpaste, and it's the mechanical action of the toothbrush removing or disturbing the plaque that's going to keep that mouth healthy.
What is your view on the paw toothbrush, the one that you can plug
Electric,
in,
the
electric
electric
toothbrush?
toothbrush.
Yes. What's your
Okay, so you know what? Some say tomato, some say tomato. Whatever works for you is fine with me, but there are a few rules. A lot of times an electric toothbrush is just going all over the place. So you have to have a fulcrum, a balance point, and you methodically work that toothbrush around to make sure that you're touching all surfaces. Otherwise, you can be using it, and at the end, some parts of your teeth haven't been touched yet. Okay? I personally, Heather Dawn, I do not like the feel of the electric toothbrush for me.
Right.
But I have many patients who use them successfully. So you have to have a balance point, and you do not put a lot of pressure on an electric toothbrush. But
Okay.
other than that, if it works for you and you're removing all that plaque effectively and you're flossing, I'm fine with it.
Is it a myth, Heather? Remember back in the day when we never had those white fillings, we had the silver fillings, and then we heard that the silver fillings were causing issues, causing all kind of well, say cancer and all these things. Is that a myth? Because some of us had, like me, had them replaced with the white filling. So is or was that a myth, or and what should we do in terms? Because I mean, do people still extract teeth, or is just mainly filling now and the using the well, I call it the white filling, but of course I know it's a particular type of filling which you can educate us on.
Okay, so you've asked me a couple of questions. Let's start first with the silver fillings. We refer to them as amalgam fillings. It's an alloy. It's made up of several metals, but in that is mercury, and mercury has been a very, very controversial agent. Um, Mercury poisoning is, it's one of those things that can be there causing problems over the years, and it's not easy to identify. So some years ago, it was determined that maybe people with silver fillings should have them removed because the mercury component may be hazardous to the health. Now, my knowledge and understanding of mercury poisoning is it has to be inhaled. So when it's encapsulated in the tooth, it's not as damaging as if it's inhaled. Now, there are patients over the years who have asked me to remove their silver fillings and put in composite resins or tooth colored fillings.
Okay.
I've done that many occasions. I can't say personally that I've seen a difference, but I know that there are a lot of healthcare wellness people, wellness persons who feel that amalgam in the body is deleterious. Now, I have silver fillings. I've heard that argument for the past. I've been practicing dentistry for 32 years from before I graduated. And there are some places in Europe where you absolutely cannot put a silver filling because it is a no no.
I know. Okay.
The problem is different filling materials have different characteristics. And we've learned over the years that um, tooth colored fillings do well in some areas, they don't do well in other areas. So if you take out a silver filling that's just below the gum line and you put in a tooth colored filling, um, that tooth may have recurring decay in a short period of time or become sensitive because a tooth colored filling doesn't do well in that environment.
Okay.
Now, um, you still have that mercury in tuna fish and salmon. So I always ask, have you stopped eating those big fish that are known to have mercury? You know, it's one of those things. If you come to me and you say, "Boy, I want to take out this filling," I'm going to evaluate the tooth and say, if you trouble this tooth, it may never settle down. Or I can easily well take it out for you and put in a tooth colored filling because of it's not a deep filling and we can change it out and whatever. So the debate is still there. I'm neutral.
Okay.
Yeah.
What about the next question
So
was about
the other part of the question,
removing
yes,
teeth.
yes.
Mhm.
So in the year 2020, the only reason that we should be removing teeth is if we have trauma and the teeth cannot be saved and we need to remove them. Or if children have over retained baby teeth that refuse to be
Pushed out.
exfoliated by themselves, we need to help them to be taken out. But if our hygiene is good, we really shouldn't have tooth decay. And if you're going to your dentist every 6 months, it should be detected early. And if it's detected early, then there's no reason to have an extraction. Sometimes we have crowded mouths, and in order to straighten things, the orthodontist may ask us to extract. If we have wisdom teeth that really don't have the space to come in fully and they're creating problems, we may remove the wisdom teeth. But other than those
I was
few,
gonna. That was my next question about the wisdom teeth. Some people have problem with them. Some people don't. I never did. But what would cause when does the wisdom teeth come in, and what causes the problem with wisdom teeth?
wisdom teeth come in between 17 and 24. Most times when you have a problem with wisdom teeth. So when your mom and your dad get together, we don't know whose teeth, what size jaw, what that combination is going to look like. Some people get their wisdom teeth, they don't even know where because there's adequate space. It just comes in, whoop, I'm there. Other people have small mouths and they don't have the
Okay.
space for those wisdom teeth and they're trying to push in and they can't. So every so often, there's because it can't come in all the way, there's often a flap of gum over the back part where bacteria can accumulate and it can get inflamed and infected and we have to go in and clean it out. Sometimes instead of the tooth coming into the mouth this way, it's sitting on its side or horizontal or some kind of orientation that will prevent it from coming into the mouth. Depending on what the x-rays look like, if it is possibly creating damage to the tooth in front of it, then we'll take it out. You know,
Okay.
so wisdom teeth are removed based on what the needs are of the individual persons. It's not a given that once you have wisdom teeth, they need to be removed.
Okay. Um, Mr. Henry was asking, are you allowed to say which toothpaste or mouthwash is bad?
So any toothpaste with fluoride is good for you. Any mouthwash without alcohol is fine to use. I don't care about the brand. As most times you can look if it's recommended by the American Dental Association, it's fine.
Okay, he came. I guess no, but he was there from the start.
Mhm.
You had addressed this already. If you use more than a pea-sized amount of toothpaste, could you get fluoride poisoning?
I don't know about fluoride poisoning, but if you put too much fluoride in your system, it's going to work against you. And one of the ways that it shows up is flourosis on the teeth. The teeth look
Right.
mottled, blotchy, white spots that are, the light doesn't shine through it. It looks strange or different.
All right. So all right. So my other question now, um, to speak a little bit about, because some persons are of the view that orthodontics is, whether it's fashion or, but I know for myself that I had a huge overbite. They used to call me Carol Burnett at school. So I had my top teeth were hanging way over, so I wasn't chewing my food properly. Also, because I had met in a car accident, so my center of my mouth had shifted to one side, and then my mother's dentist at the time had removed two teeth from the side. So of course the teeth were now shifting to close up the space. So can we speak a little bit about why people should do orthodontic work, having spaced teeth, what should be done, or having overcrowding, what should be done?
So I'm going to spring something on you.
Mhm.
A lot of times when teeth are out of alignment or the jaw is out of alignment, it has to do with airway issues.
Really?
Mhm. Because if you're breathing properly through your nose, then your mouth is closed. And when your mouth is closed, your tongue sits passively in the roof of your mouth.
Mm-hmm.
Okay? The roof of your mouth we refer to as a palate.
Mm-hmm.
So if I could cut your face cross section and I could see your palate, it would just look like a U.
Right.
Okay, and at a point of rest, that tongue would be sitting in the palate, and on the outside of your face, your cheek muscles would be pushing in on the top part of the palate. So we have a balance of the muscles pushing up and pushing down. Let's say you're not breathing properly and you're a mouth breather. Now the tongue is not in the roof of the mouth passively, it's in the floor of the mouth. So
Right.
now this palate doesn't have that pressure of that tongue up there, but it certainly has the pressure of the cheek muscles. So instead of having this nice round arch, you have a V because the outside muscles are pushing on and there's no inside muscle to push up. Okay, so now you move from having a nice round arch to have a V. Well, what does that mean? If you are looking at that cross section at the end of each V, they're your teeth because the roof of your mouth is rounded and
Right.
you have your teeth.
Right.
If you are looking at a V, teeth come in. When the teeth come in, where's the space for the tongue? There's not much space. Tongue is pushed back.
Right.
So you're doing whatever you need to do to focus on breathing to get that oxygen. So oftentimes, people who are mouth breathers have airway issues. It creates a malformation of the face because over time, if you're a mouth breather, you do this. right? It affects your posture as well. So orthodontics may help to space back out that arch. What you are speaking about with that thing in the roof of your mouth was an expander. So it was taking you from this to expand it back to that
Oh,
nice arch in the roof of your mouth. Okay, so that the teeth could spread out, so that your tongue would have some space,
and my center was corrected.
and your center was corrected. Now, orthodontics, or the field of dentistry that focuses on straightening your teeth, helps people who have issues, maybe their airway issues that created that malformation, or maybe you're born with mommy's small jaw and daddy's big teeth, so the teeth are crowded, or maybe it's the reverse, so you have daddy's big jaws and mommy's small teeth, so you have a whole lot of space between your teeth. Um, Maybe the way you're swallowing, you're pushing that tongue forward and the teeth are flared. So any number of reasons will cause
And I
your
was
teeth
sucking
not
the
to be.
thumb.
Any oral habit, sucking your tongue, sucking your thumb, your fingers, your lip, any of those things can create a mal or a bad occlusion, the way the teeth go together, right?
Okay.
And so the
I see that.
specialty, the specialty of orthodontics helps us to properly align the teeth so that they can be cleaned properly, so that you have equal forces when you're chewing, so that you can pronounce your words properly, so that you have an equal alignment of the face, right? Because sometimes you have this alignment that is off, and you think that that's where it is, and that's the only problem, but it's affecting your jaw joint, which can affect your spine and your support, because everything is joined
Wow.
together, right? So the orthodontist can really play a vital role in bringing back good health. Here's a problem though. Somehow along the way, people are now looking at braces as a status symbol, right? Like jewelry. So we have persons who don't understand the physics behind it running to people who are not trained to put on fashion braces.
Braces.
Now, the problem with fashion braces is there's no such thing as fake or fashion braces. What happens is that you have people who don't understand the physics or mechanics working with the same things that orthodontists use without the orthodontist knowledge,
Knowledge,
and
right?
creating forces that are unhealthy, that send roots out of the gum, that create open bites that weren't there before. Because once you join teeth together, that wire is going to create a force that is either healthy or unhealthy. And unfortunately, we have this new craze where people want to look like they can afford braces, so they're putting on fashion braces, much to the detriment of their health. So we discourage that. An orthodontist is, so I went to Howard for 4 years, applied to dental school, did 4 years. After that, if I wanted to be an orthodontist, I'd have to do an additional 2 to 3 years. So it's quite a bit of training to
Right.
learn how to move teeth around in your mouth. So to go to someone who has no dental skills to do that is really putting your life, your health at risk.
That was the importance of the what do we call it, mastication or mastication of food,
Chewing.
chewing. So that also is is important with getting your teeth aligned as well.
So,
The
we're
ability to chew
fearfully and
your food.
wonderfully made. If you should look, if your teeth are properly aligned, we have hills and gullies, and each hill fits into a gully perfectly. That's what allows you to chew your food. If you are chewing with teeth that are properly aligned, the force is going through the long axis of the tooth. So it can bear up to 200 pounds. So you see, when you bite your tongue, is a serious bite
Yes,
that has a
yes.
lot of force coming together. But because of how the teeth are aligned, the teeth can absorb those forces. if your teeth are out of alignment, those same forces can cause you to break your teeth. It can shift your teeth so that your teeth don't come together, so you're not able to chew your food properly. So it's not just about how they look, it's more about how they function.
Mhm.
And if you can't chew your food properly, you know that you're going to have digestive problems, etc., etc., and etc.
And that's the same with wide spaces because it's not coming together. Because I find with wide spaces also, for people what we call scattered teeth, they're not together. I'm normally well, it appears to me that when there's a space, the teeth does not have support. So would you recommend that someone with spaced teeth does get orthodontic work? Because some people think it's cute.
So we have to examine why those spaces are there. Let's say you have a tongue thrust. When you have a tongue thrust, instead of when you swallow, the tongue goes into the roof of your mouth, the tongue goes forward and flares those teeth. Teeth that are flared because the tongue is pushing out often are spaced. So if you try to correct that without correcting the cause of the problem, as
Get
soon as those braces come off, those teeth are going to be flared again. So we kind of have to do some detective work to find out why the teeth are spaced. But
get
let's say it's dad's huge jaws and mom's small teeth, and so we just have spaces. Then there's a way that we can figure out to correct that orthodontically that is functional and aesthetic. Now, when you have spaced teeth, not only do you have to worry about chewing, but you also have to worry about saliva. Those people may be speaking and
Oh,
inadvertently saliva is coming out because when you speak, you use your tongue and your teeth to formulate a lot of the sounds.
right.
And where I have teeth that are close together, my saliva is going to stay in. If there's space between your teeth, the tongue will flick that saliva out. So there are a couple of reasons why we would want to address teeth that are spaced.
There's another thing that I have a friend who has a daughter, and she fell asleep one day in the car, and her teeth were like literally singing. They were grinding. What causes grinding of the teeth? I mean, it was
So
like it
there's
was
a
a
Jamaican folk tale that says if you have worms, you grind your teeth.
temper.
I have not found that to be so. But there are a couple of reasons we know why kids grind their teeth. And again, I'm going back to the airway. So let's say you go to sleep and your breathing is not what it should be. Your brain says, make space, make space. And so that kid has learned how to try and keep that jaw forward so that that airway will be open, but the teeth are in the way. And so you hear this grinding.
Yes, I
So a
mean,
lot of times
like
when I
being
see when I see children that have this pattern that their teeth are ground down, I look
yes,
at the back of the throat, enlarged tonsils and adenoids. Sometimes you look at the back of the throat, the tonsils are like this, and the uvula, that thing that sticks down, is like this, and between the three things, there's literally no space back there for that kid to breathe. So whenever I hear of a child grinding, I will look to the back of the throat to see if there's something there. We used to say, well, stress, but we realized stress is not so much a problem when we're listening to children. It's the body telling us that something is trying to compensate for something.
wow. That is so much information. But we touched on did we get in did we get into the sleep apnea? Did we?
Okay.
We touched on it, but I
So
want to tell him a little bit about the whole um because many people just people say, Lord, him can't snoring, or Lord, she's snoring, and boy, the snoring loud and I can hear you from down the road. But we don't think about the health impact of snoring.
So Sandra,
What can you think about that?
how I like to describe it is, if you are in a wide open field and it's windy, that same volume of wind would sound very different. If it was going through a tunnel, it would sound very loud. If someone is snoring, it often means that there's not a lot of space back there for the air to be passing, and you have movable tissue. So you have limited space and movable tissue, and so you hear something as the air is trying to force its way in, and you refer to that as snoring. So snoring isn't cute. Snoring is an indication that there's some airway issue there that needs to be addressed. Doesn't mean that you can't have an airway issue without snoring, because you can. But a lot of times when somebody snores, if somebody says, I can't stay in the house when Dennis is here because Dennis snores so loud you can hear him 2 doors down, that person has a condition that is life threatening, because that snore is so
And we usually make
loud.
a joke of it.
Yes, it's not funny. That person is having trouble breathing. And in fact, sometimes you'll hear the snoring, 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 and then silence. Because
Yeah.
at that point, when you hear silence, that airway is shut. And it's silent, it's silent. And if it's a bed partner, the wife or the husband will almost elbow them and then and then start snoring again. And the bed partner can go back to sleep because they know, okay, they're breathing again.
Right.
But you literally stop taking in air when that airway closes off. So let me just touch a little bit. If you have sleep apnea, if you have airway issues, there's several ways to manage it. The most popular reversible way to manage it is with a continuous positive airway pressure, or CPAP machine. And that may cover your nose, or may cover your nose and your mouth. And it essentially works like a reverse vacuum cleaner. So it gently pushes air down that tube to keep that airway open so that it cannot collapse. Okay? Now, I always say to people, as you said earlier, you have to give your body permission to get adjusted to something new.
Right.
There are different machines on the market. Usually, I recommend something that has some degree of moisture. So, if you have air constantly going down your throat and it doesn't have any degree of moisture, you're going to dry out, you're going to cough, it's going to be
Have a
uncomfortable.
humidifier attached to it, yeah.
Right, right. Some form of humidifier attached to it.
Mhm.
If you're a mouth breather, then you're going to need something that covers your mouth and your nose, because if the air is going through your nose and your mouth is open, a lot of it is going to come back out before it gets to go down that tube and keep that tube open.
Mhm.
There is another appliance that is removable, but it's dental. It's inside your mouth, oral. And basically, it works differently. The upper arch, the top part of your jaw, does not move, it's fixed. If your mouth is moving, it's because your lower jaw, hinged to here to the rest of your head, is movable. So we use an appliance that is like a retainer on the top and retainer on the bottom, and they're connected with straps. And those straps, as we shorten them, allows the upper jaw to move the lower jaw forward incrementally. So when you're sleeping,
Ah,
that tongue can't roll back. Now, you can get a closure of that airway at any level, from the nose going back down. But the majority of those airway closures occur between the roof of the mouth and the floor of your tongue. So a lot of times, if you can prevent that airway from closing off at that level, you can. Moving to more invasive type treatment, sometimes orthodontics, opening up that arch, as I shared with you before, can allow the tongue to move forward so you don't have that being trapped back there. Sometimes it's a combination of oral surgery to actually split the palate in half, and then the oral orthodontist uses the equipment to keep it apart so it stays. Sometimes the ENT can go in there, remove soft tissue, tonsils, adenoids, and sometimes extra tissue in there. Or sometimes it's full blown head and neck surgery where they actually move the upper and the lower jaw more forward, so there's more space between the spine and the back of your jawbone.
Wow.
So there are many ways to manage it, and it just depends on your situation and what's happening and how invasive things need to be.
So you would recommend tell persons who are having serious snoring issues to go and get it checked out ASAP.
I would say if you have a baby or a toddler that snores, is not cute. Find out why that kid is snoring,
Right.
right? In general, if you are making noise when you're breathing, there is a problem that needs to be addressed.
Wow. There's just so much. Is there anything that I have not touched on that you would like to add? Oh, I haven't touched on things like the various different things that we can do to enhance now in terms of replacing teeth, doing your, what do you call it again?
Implants?
Implants. You can do implants. And when you do a full set of,
Okay, so let me just share this with
yes,
you.
yes. Tell me
Um,
about the
in this day and age,
upgrading
we
now.
in this day and age we can do a lot to prevent tooth loss. But
Right.
let's say there's trauma, you get hit in the mouth, or a root canal and you didn't put a crown on it and it broke and you had to extract it. There are two basic categories. You have removable appliances, you put them in during the day, you take them out at night. And you have fixed appliances, they stay in your mouth permanently. Now, a removable appliance is what somebody would call a plate or a denture. It has a clasp. It can be made of all acrylic, all plastic, or it can be a combination of metal and plastic. And you clip it in. You don't want to sleep with it because your soft tissue needs time to breathe. And if you
Okay.
keep your dentures in all the time, the worst case scenario is that you could develop cancer. Because
Mm.
underneath that denture that should be breathing, the tissues undergoing negative changes that can lead to cancer. Now, let's say you have a one tooth missing. There are two ways you can permanently fix a replacement in the mouth. You can use either an implant. Now, an implant is a fancy name for a man made replacement for the root of a tooth. So, if you can picture it kind of resembles a screw,
Like a
and
post. Yes.
and the surgeon puts it in the bone and covers it up, and he leaves it for a few months until it gets properly integrated into the bone, and then he sends the patient to me and I restore it with a tooth like a appliance, and it's
Uh,
freestanding so you can brush and floss it. It's not attached to any other tooth. It functions well as long as you keep it clean and healthy. One tooth missing, another option is to use the adjacent teeth to hold the replacement in place.
with a
And we
clip.
refer to that, no, it's no clip. The
Oh,
teeth on either side of the space are reduced in size. And we make two coverings that are cemented in place. And those two coverings will hold in place the replacement. So when I am smiling, it looks like there are three different teeth, but they're really attached. But our labs can make things look so fabulous that you would not know the difference. So a bridge relies on the adjacent teeth to hold it in
that's
place.
what you call a bridge.
Yes, an
Okay.
implant is retained independently of the adjacent teeth by putting a man-made replacement in the bone and then restoring that. A denture would be something that you clip in and at night you clip it out with that one tooth.
Okay. Is there anything that you want to add to our discussion that I have not thought of because I don't know everything about
I
dentistry?
think you covered so much tonight that I'm grateful for anybody who is still on the line following us.
Yeah, man, they are very much there. They are very much there. Well, I mean, if there are no more questions, folks, you have a few more minutes to just ask any last minute questions. that you have to ask. Dr. Lawson-Myers has done such a fabulous job. I mean, I feel my head is spinning with the amount of information that she really covered tonight. Um, where can we find you? Please let them know where we can find you again, and a contact number, your address, your social media handles as well, where they can find you online, because you do have many blogs that you do on a regular basis. Very interesting. Um, and I'd like to share it with my village.
Okay, thank you. That's very generous of you, Sandra. We used to be located in Ligony above what is now Juicy Beef.
Right.
And as a female, I had the prerogative to do what I wanted with the name, and I kept it. And so now Ligony Family Dental is no longer located in
Right.
Ligony, but we're just below Stanton Terrace in the Seymour Park office complex, suite number 3.
Right.
Easy to find. We have a website, Lig Dent. You can easily find us there. We have a Facebook page. We're on IG, and we have a series of vlogs, video blogs on
And all
YouTube
of them have the
called
same name.
HD's Jazz Journey. So the
Okay, so give us
YouTube,
the different, right? Give us the different names for the different.
okay. So if you look for Ligony Family Dental, you will find the website online. Okay. If you are looking for our IG, it's ligfamdent_876. If you're looking for our Facebook page, just look for Ligony Family Dental. We're there on the Facebook. And
That's where your blogs are.
no, our vlogs are
Vlogs.
on YouTube, and
Okay.
it's HD's Jazz Journey.
Okay.
HD's Jazz Journey on
Okay.
YouTube.
Okay.
But oftentimes you'll
Please,
find
please
our,
send me, please send me those, and I'll just post them when I repost the video after our show, so that they can find you. Because many people looking for a good dentist, many people looking for a dentist that don't cause pain, and I'm telling you, I'm one of those people who are really afraid. So when I go to somewhere and I stay there, it means that I'm comfortable. It means that I'm getting the treatment that I want in terms of pain-free treatment. And I'm very happy with you. Very, 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 very happy.
thank you.
So I recommend her highly. And so whenever you're ready to take care of your teeth and to get some more information, because I like to go somewhere where I'm getting, value for money. And I feel like I get a lot of value when I sit down and someone can discuss and go through, and they're patient with me, and they take the time to, give you information that not necessarily, has to do with your area, but you are sending me on now to get whatever it is fixed, which I truly appreciate, because now I'm sleeping well at night.
Mission
So
accomplished.
mission accomplished. And that is why, too, friends, you have to go visit your dentist. You have to visit your optician or ophthalmologist at least once a year. You have to get these things done, because in case anything is changing within the year, I see a cardiologist, I see my gynecologist, I see a GP. Well, in my case now, I go and I see my surgeon every year to, just to check up to see what's going on, because our health is our wealth. It
Absolutely.
is. Oh, it's someone had asked if can dental implants cause cancer.
I've never heard of any implant causing cancer, but what I can say to you is that whatever you have in your mouth, you have to handle it with care. And if you are visiting the dentist every 6 months, one of the things that we do is clean, evaluate if we need to take x-rays, because oftentimes when things are going wrong, you don't necessarily feel pain. So
Right.
our job is to alert you to any concerns that we may see so that you can get proper care. But the short answer is I have no knowledge of implants causing cancer.
Okay. Cicely is also asking for your contact number.
Oh, 876-978-6103. 876-978-6103. We're in the book Ligony Family Dental.
Lovely. So thank you very much,
You're
Dr.
welcome.
Lawson-Myers, my friend Heather.
It
Thank you
was
so much for joining Boss Lady Live tonight. I know my village has gotten a, a wealth of information. Please like, share with your friends, subscribe to our page www.youtube.com/the totally male. Or we also repost on Facebook as well, so you won't miss the information. But the thing is to get the information. If you joined us in the middle, we post right after the show, so you can always get the information, all of the information from minute one to the end. Thank you so much for joining us once again on Boss
thank you.
Lady Live. Next week we'll be back with I think is it next week? Yes, next week we're having a show on it's men's International Men's Day on the 19th of this month. So we'll be having discussions on what it means to be male versus man, because they're not
Hmm.
the same, right? They're not the same. Male versus man. What does it mean to be a man versus just a male, right? So very interesting. I'm going to have about 6 males talking up the things them. Awesome males, standout dads, I like to call them, holding down their, families and, you know, out there looking it and making it happen and taking care of their families and themselves. So we'll be speaking about that next week. You don't want to miss it. So you want to talk, we want to deal with the men next week, Monday. So look out for that. Oh, what is TMJ?
Oh, that's your temporomandibular joint. It's a
Okay,
joint that joins the lower jaw to the rest of your head. And if there are alignment issues, you may have temporomandibular joint disorders. That's for another show,
that's
but
another
it can lead
show.
to unexplained head and neck pain,
Okay,
shoulder pain going down your back. Yeah.
right. So, well, you know where to find her now, don't you? Right? And if you missed it, just rewind when we post, and you'll get all the information. Thanks again,
You're
Dr.
welcome.
Lawson-Myers.
God
Thank
bless
you,
you.
bless you, bless you, bless you. May your basket never be empty.
Thank you.
Bless you. Okay, folks, next week, see you same time, same place on Boss Lady Live. And remember, it's male versus man next week for International Men's Day. Good night.